Good morning, everyone. Thank you for logging on to our website, to our webinar again today. We appreciate you. Today promises to be very soft because we're going to be looking at some of the things that we are all aware of and that affect our lives and that could save lives as well. The webinar is brought to you by Wellness Healthcare Group. Wellness is a customer-centric organization. We are too much in the business of ensuring that all our clients and customers enjoy seamless access to care on our HMO platform. And from our pharmaceutical stores, we ensure that they enjoy quality pharmaceutical care and pharmaceutical products. Please, if you joined us, don't forget to share the link with friends and family. They also need to be a part of this because we're going to define what emergency is, and we're going to look at some of those things that we've been taught. And the doctor is also going to clarify, the doctors will clarify some of those things that we've been doing wrongly. So share the link with friends and family. And also don't forget to subscribe to our YouTube page. I'm going to be handling today with Dr. Toby. Dr. Toby is the head of medical services and wellness HMO. Is doing a fantastic job in making sure that all our enrollees enjoy quality access to care. So Dr. Toby, you're welcome to today's webinar.
Thank you very much, Ma. I'm so much happy and delighted, and I'm highly honored to be a speaker, and my boss is actually the host. So it's actually a very great privilege, and I really, really appreciate this.
Thank you, Dr. Toby. So we're also expecting Dr. Udiom is a consultant, general practitioner consultant that practices in UK, is a Nigerian. So he's going to join us very soon. And this is Mr. Joshua. Mr. Joshua, it helps us to reach out to some group of people that may not be able to hear us, but they see signs and they understand what we're trying to say here. So Mr. Joshua, you're welcome. Mr. Joshua, please say a word or two to the audience.
Good morning, everyone. Good morning, everyone. I'm glad to be here today.
Thank you, Mr. Joshua. Okay, wellness crew, don't forget to, for our audience, please don't forget to send in your questions on the chat box on the YouTube. You can send in your questions and the doctors will clarify. We are going to share some of the questions some of you have told us to ask and some of the things that bothers us as individuals as well. So please don't forget to ask your questions. The crew will make sure that the questions gets to me, and I'm going to be asking the doctors. So Dr. Toby, let's start right away. I don't want us to waste too much of our time because there is so much plenty of one bed today that people would love to attend as well. So Dr. Toby, please, can you describe what emergency is? What is emergency? Or what is, okay, emergency generally?
Basically, when we talk about emergency, we're definitely talking about something that is actually unexpected, something we didn't plan for. So emergency basically is an unexpected situation in which we find ourselves, and most times it's called emergency because immediate action needs to be taken. If immediate action is not taken, of course, there could be loss of life, there could be a form of permanent disability. Also, there could be loss of properties, as the case may be. But when we are talking about medical emergency itself, it's actually an unexpected and often dangerous situation that requires immediate medical action. If that immediate medical action is not taken, then there could be a form of disability, which could be permanent, or it could result in a death. So basically, that's emergency.
Thank you, Dr. Toby. So for our audience, really, we're going to limit ourselves to medical emergency. We omitted medical in the flyer. So we're going to be limiting ourselves to medical emergencies today because there are so many emergencies, road traffic accidents, things happen, leaking of gas at home and all that, or something, a crane falling off and all that. So we're not going to look at some of those emergencies. We're going to limit ourselves to medical emergencies. We're going to be looking at some of those things that as parents, as individuals, you need to have in your homes to reduce the impact of this unexpected situation. Dr. Toby said it's an unexpected situation, so nobody prays for emergency, but we need to be prepared for emergency. So that's one of the reasons why we're having this webinar, so that we can be prepared for emergency. The preparedness is what will allow us to have immediate action taken. So the preparedness allows the immediate action to be taken. So Dr. Toby, so I'm going to be asking some of the questions. I remember when I was younger, my mom used to use salt for everything. My mom used salt for everything. So when you're cooking and hot water splashes on your body, she said you should put salt. If you are having stomachache and you say, "Mommy, I'm having stomachache," she tells you to put salt in the water and drink it, and you'll be fine. Yes, at a point, some of those things work, but we want to be medically correct right now. So that we're not just believing in some myths that are not working. So Dr. Toby, so I'm going to be asking different situations, give you different scenarios, and you're going to be helping me what people can do. So at the end of this webinar, we're also going to be able to say that for emergencies, parents, individuals should have these products in their closets or in their kitchen, so that should in case these things happen, they can use this to treat it. So let's look at this. Some people are not asthmatic, and all of a sudden they just have difficulty in breathing. So what do you think anyone that is around them should do, or even the individual that just does not understand what is happening, but he realizes that he couldn't breathe well? What are the first aid things that people should do to help themselves?
Basically, if you're talking about someone that's having difficulty in breathing, is actually one of the most serious, or I would say in quotes, it's actually a kind of serious emergency that should not be taken lightly. Most times, there's usually an underlying cause for it. But you said in the case where the person is not asthmatic, at the same time, you should not just think it's normal, because there can actually be an underlying cause. And we should try as much as possible to see first what we can do to help the person, probably before we get the person to the hospital. And the first thing that we should do when someone is having difficulty in breathing is to make sure that we lose all clothing, meaning if there's a tight clothing anywhere in the body, you take off the ties, you take off the buttons of the shirt, you try as much as possible to expose the person as much as you can. Of course, if there are windows, you open the windows to bring about cross ventilation. Then at the same time, try and make sure that the person is lying down, that's upright on the floor. If you can check the mouth to see if there's anything blocking the mouth, of course, you can do that. But if there's really nothing blocking the mouth, and don't forget, at that point where someone starts feeling breathless, the first thing to do after doing the removal of the clothing and everything is to call for help in case you are the only one. If there are others, then someone should get help, should call for help. So in that case, most times for breathing difficulties, and the person is not asthmatic, it could be a spectrum of so many other diseases, because people don't just feel breathless. Of course, we know that some other things can cause it, any form of allergy apart from asthma. And don't forget, also fumes, smokes, and some other things can cause it. So once we can identify the cause first, for example, if it's smoke or something else, we need to take the person away from that environment immediately. They lose the clothing. But if we are not able, after all this, to identify what is actually causing the breathlessness, then of course we might need at that point in time to seek medical attention. Of course, if the person is breathless, so the person is still breathing. So it's not like the person has lost breath. If the person has lost breath totally, of course, that's another ball game, which we might need to do other things. But if the person has not lost breath entirely, at that point in time, if you cannot identify the cause, and even with the removal of the clothing, if it doesn't get better, then you might want to seek a professional advice. Well, in some cases, depending, you might want to do a CPR, that's pulmonary resuscitation. But I said, if the person has not lost breath completely, there might be no need for CPR at this point in time. So if not identified, just seek for help, because breathlessness is actually very, very serious thing, and we know the impacts that losing breath can cause to the body. So I think that's just the safe thing to do at that level.
Okay, thank you, Dr. Toby. This is also to remind our audience, we're not saying that we want to handle emergencies so that people don't get to the hospital. We're saying that what are the first set of things that we can do to help anyone that it's caught up in this particular kind of situation. So Dr. Toby just told us now that when someone is breathless, the first thing that we should do is to remove the person's clothing and allow the person to gain some fresh air. If the person is in an enclosed place, let's open the windows, open the door. Maybe some people are fanning the person and all that, especially if the person has not lost his breath. But if the person has lost his breath, then CPR has to be performed. CPR is a different course on itself. We're also looking at how to have people come on this webinar and tell us some of the basic CPR, because we found out that in some offices people just collapse and everybody just run. In Nigeria, is either people are running or people are, just bring out their phones and they keep capturing the events on their cameras. So we're going to have a time for CPR. is a broad and a big deal. But what he has told us right now is that breathlessness can happen even though you are not an asthma patient. And when it happens, the best thing is, even if you are the one feeling breathless, quickly remove that tie, quickly undress so that you can get fresh air, move to where there is air, open the windows. So don't just go and sleep. Don't just go and don't feel helpless. These are very important for us to do. So thank you, Dr. Toby. Another thing there's another question. There's so many questions here. So I remember that when a child Hello, Dr. Toby. Did you get my question? I didn't know my internet went off.
No, it went off completely.
Wow. Okay, so I'm saying that sometimes a child runs around in the house and hits his head and the head gets swollen. On the some people say don't press. Some people say use ice cube. What do you think should be done?
Okay, so if there's a swelling and okay, just of course, a lot of things have taken place before that swelling came into place. Of course, there's a trauma, which is properly a blunt trauma, and there's inflammation, then there's fluid retention, then of course there's a swelling, and medically we call that edema. So when that happens, of course, the first thing to do basically, which is very, very effective in most cases, because one thing that first aid does is that it reduces the severity of any form of illness. Meaning, if it would have gone maybe on a scale of 0 to 10, if it can have been 9 at level 9, meaning very, very bad, of course, it can be curtailed to level 3, to level 2, level 4, and we reduce the effect and the severity. Basically, what should be done when that happens is actually everybody should have a form of ice block, of course, in the fridge, basically, so that when things like this occur, they can easily pick up the ice pack or ice block. But of course, we try not to apply directly on the skin because, of course, there could still be some, of course, physiotherapists do tell us that there is what we also call cold burns, meaning you don't just eat that burns, even cold. even ice, so there could be ice bomb. So basically, we wrap it in a clothing or a towel, a light towel, then we apply and keep it there for like 20 minutes. So basically, with that, it helps to reduce the inflammation that has taken place. It helps to reduce the swelling that has taken place, and eventually the edema does not get so bad. And eventually, that might be basically all that the person will need to do. If at all you need to add anything else to that, then maybe you just make use of medications, painkillers, paracetamol, or the non-steroidal anti-inflammatory drugs. That's the ibuprofen, the aspirin. Those are, and that might just be all. But if after the swelling, depending on the part of the body, especially if it's in the head, and you are of any other form of symptom that the child is exhibiting, because of course, head injury, you might not know the extent. And of course, there could be blunt injury. So if you are not sure of the kind of symptoms that the child is exhibiting, then you might want to go further to seek medical attention. But in most cases, all you just need to do, apply the cold compress, 20 minutes, then maybe later after 20 minutes, you can apply again and just give non-steroidal inflammatory drugs, that's ibuprofen or paracetamol. And most times, that's just all that you need to do in that kind of situation.
So parents should not rub that place.
Well, rubbing, basically, if there is no, it's not as effective as applying a cold compress, but rubbing too is effective in its own way. Meaning, if you are not able to get an ice pack at that point in time, of course, if you rub, even with an ointment, any form of ointment, if you rub, of course, it still helps in reducing the inflammation in its own way.
Okay, so one could rub. What you have said today now is one could rub, especially when you don't have high blocks or high skills to do the cold compress. One could rub with ointment, and yes, one can actually do the cold compress. And after doing the cold compress, you can now give some non-steroidal anti-inflammatory. Okay, so Dr. Sobi, someone is cooking and frying dodo, and all of a sudden has an oil spill, or somebody is trying to make eba and did not look well, and the hot water spills. I know that my mom used to say you should put salt in immediately, and after you put the salt, we actually usually put ori, shea butter. Is this the way to go, really?
Well, thank you. Actually, people do a lot of things, and funny enough, it helps in its own way. It helps in its own way. So, of course, salt is a natural element that, of course, on the surface of that, of course, most salt does it from seawater and everything. So, salt has its own therapeutic effect, and that's why a lot of people tend to make use of salt in a lot of cases, because they know that most times salt is actually not harmful and it's more beneficial than harmful in most cases, and probably that's why a lot of people employ the use of salt, and of course is very readily available. But when it comes to boiling water, what we should do basically is that it's a form of burn. If the boiling water should pour on any part of the body, whichever, of course, what we expect is that there might be a burn. But the fact is that most times, for those that have probably been burnt, you notice that when you get burnt, you don't notice the effect immediately. The effect could show over a few hours. In the sense that you get burnt and maybe the skin has not even peeled, but of course the skin is damaged and all those things, and eventually it will peel. You might not even know the surface area that is being affected at the point in time. So basically, to reduce the effects, just like I've said, to minimize the extent of severity that it will have caused, the first thing to do when you have burns, which any form of burns, whether hot oil or hot water or hot food, any form of, or even iron, any form of burn, the first thing you should do, that area, just go to a running tap. Even if you don't have a running tap, just go to anywhere you can find water, even if it's to pour it yourself. And so let's use tap for example. So put the surface area of the burst area under a running tap for at least 10 to 20 minutes. So without doing anything, at that point, you don't rub, you don't do anything, you just allow cold water to run on the surface of where, of whatever, of where you've been burnt. So basically, that's the first thing to do. You should run it. Why you run that? Basically, a lot of it reduces this pain. Of course, it is initially painful. It reduces pain. Basically, the skin damage reduces because a lot of skin might. Of course, it will show immediately. Then, so after doing that, running water, which is very, very important. That's the first thing. After running water, then you can now assess probably how damaged it is. At that point, of course, you need probably not antibiotics, basically, we need something to relieve the pain. And that would be the paracetamol or non-steroidal anti-inflammatory drugs. Most times we prefer non-steroidal anti-inflammatory drugs because inflammation usually takes place. But burns, if it's not a minor burns, once it gets big, in the sense that the surface area is big, of course, you will need a medical attention. But if it's minor and it's not that big, of course, it's something that can be managed at home. And all you need to do, of course, probably before the end, we advise on the kind of things that people should have at home. Of course, after running it, you can clean the surface gently with disinfectant. Then you apply gauze, sterile gauze on the surface, and that might just be all. But in children, because children, every form of burns causes dehydration. That's loss of water fluid, and it's of course both in children and in adults. But in children, the effects might be more than in adults. So if burns occurs in children, of course, it's very, very okay and very, very advisable that even at the end, after doing the first aid and everything, you still take the child for medical attention because a lot of fluid might have been lost. They might need to replace fluid. And of course, depending on the site or where the injury is, they might want to give intravenous fluid and they may want to give antibiotics just to prevent infection so that at the end, the severity is not that much. So basically, I think that's basically what we can do initially. All right, so, okay, thank you. Sorry for the interruption. Okay, so at this point, I think I will take over the moderation and I want to welcome my friend and my colleague. Okay, so he's a general practitioner, consultant, general practitioner in the UK. So I will want to welcome Dr. Yenimi Indiomu to this session. Please, can you please say hi to our audience? Please unmute yourself and say hi to our audience. Dr. Nimi, I think you're on mute.
Yes, okay. So, yes, thank you. So my name is Enimi Indiomu. I'm a GP in the UK. Sorry I'm late. I think I got the time zones mixed up because Nigeria is like one way ahead of us at the moment. Thank you. Nice joining here.
Thank you for joining. Okay, so I will continue from where we started. Of course, we've started with taking some questions, and of course we've defined what emergency is. We've talked about what we can do in cases of burns, or and we talked about what we can do as well when there is breathlessness, basically. And of course, if there's swelling as well, I think we've talked about the things that can be done basically at home. So I think those are the things we've talked about. So we'll continue from there. So of course, I know you practice in the UK, and of course, the way you practice there, of course, might be a little different from the way we do things here. I know everything you call 111, but in Nigeria, there's no 911 to call in Nigeria, if I may say. So basically, we should understand that a lot of us, when things happen, we need to probably want to rush our relatives or all our staffs to the hospital. We don't actually wait for 911 to come to our rescue, because they might never come. And so basically, so let me continue. So I will just probably allow you to give the definition of emergency, then I will continue from the questions that we asked. So in your own words, please, can you just enlighten us or give us, or tell us, of course, we are putting it down to medical emergency.
Yeah.
So can you just give us a brief intro to what emergency is basically?
Yeah. That question, emergency, I mean, sometimes it might be safe to define it as to what the individual considers to be an emergency. Because if they feel at that state they're uncomfortable, if they feel at that state that they may be threatened in any way which they are concerned, it's definitely something that would make them either to seek help from a health professional, or from, probably, as you mentioned, in a place where they may not have people who are trained health advisors that can be easily assessed. They can always seek for someone, maybe an elder, someone who they feel knows better, to give them some advice. But generally, when we talk about emergencies, see, like if you call a 999 service here, what they would say is that, is there any threat to life? Is there any threat to your limb, your sight? Is there any threat to any vital organs in the body? So generally, that's what I would say is an emergency. But, you know, most times it's the medical professional who can say, you know, in the very actual terms, that there is definitely a threat to vital organs or any part of the body. So most times it's putting in the patient's words, it's things in regarding to your body or your health that you feel threatened about.
All right, thank you. Okay, so let me continue from the last question that we took. So in cases of burns, what do you advise the parents to do at home when there's burns, and it can be a form of hot oil or water or any form of burn or burn? Of course, what do you advise that we do as a first aid?
Yeah.
As a first aid.
I mean, burns have different categories. They're, you know, ones which can be managed at home, and then most times you also need to rely on how, you know, well-informed the patients are, or the parents are of a child who probably have had a burn. Two things. I mean, generally, medical terms, we use the size of the burn to determine how bad the burn is. It may be in the depth, how deep the burn is, the width, how wide, or what areas or sites of the body that the burns have affected. And that gives us an idea of how bad or how severe the burn is. And all those things will inform us as to, do we need to keep this child or this individual in the hospital who has a burn? Do we need to treat? Do we need to support with fluids? So generally, in terms of, you know, as an individual at home or a parent of a baby who has sustained a burn, it's to see for yourself, where has this burn affected? Has it affected vital areas, in important areas like the face, the genitals, even the chest, those are very key areas that would say this may not be something I can handle on my own, and I'll need to probably seek advice from, someone who knows better. There are health advisors. In Nigeria, sometimes even the people who run the local pharmacies may have some health information, because I think part of what I was reading, you talked about this information is for people who may be traveling home and they may not really have health centers very close to them or access health services. But in general terms, it's, you assessing the burn to see how bad you think this burn is. If the burn is not so bad, so if it doesn't affect vital or key areas, like the genitals, the face, areas that are really, really that may be exposed to an infection, it's something where maybe applying some barrier cream to the area. So things like Vaseline, and mostly what that does, it tries to cover the area against infection, and then watch. So it's important to know what while we're worried about burns, is that the topmost layer of the skin is taken off. So that way one can easily lose fluids. So at home, ensure the person is taking plenty of fluids, and also ensure that the area, where the baby or the person sustained these burns is clean, and it's covered with a barrier layer like Vaseline, and that way you prevent infections from happening. Good nutrition as well. But always remember that you first of all assess, how bad, how deep is this? How wide is this? Has it affected vital areas? If it hasn't, then it's probably something you may be able to manage at home. And when you manage at home, how do you prevent complications?
Okay, thank you, Dr. Ndiomi. That was quite insightful. Okay, all right. So I will point your attention to something. Of course, in this part of the country, we eat fish a lot. If you're familiar, if you could remember that, of course, we eat fish a lot, and and sometimes people choke on the bones of this fish. Of course, the bones, of course, sometimes it could be missed because it's quite tiny. So in case you are taking swallow, or maybe it has been mixed with the vegetables, sometimes you don't even know when you swallow these bones, and at a point in time, of course, you get choked with the bone, in the sense that the bone is there, basically. And so how do we educate our listeners, our parents, of course? Is it all cases that needs to go to the hospital, or what do you think they can do when such kind of situation arises?
We all grew up in Nigeria, and we remember some of the. It's hard for anyone to say that bone hasn't been stuck in your throat before. So it's something where see what you can do at home, and simple measures of probably drinking a bit of water, see if that clears it. I think first of all, prevention. It's try, whenever parents who are cooking, sometimes you may fish out for fish bones in the fish and take them out before cooking them. And also, if it's something children are going to eat, you probably, before you start serving the children, try to take off the bone from the fish, because bones getting stuck in the throat, surprisingly can be an emergency. And then if eventually happens, because sometimes, even after you've tried to prevent everything, some things still slip through the net. Things like drinking water to help you clear it, having some solid to see, even things like a swallow, a mold of eba, and see if that helps push it down. If it's still not going, so you've tried all these measures, you've tried to drink water, you've tried to take a mold of eba, it's not going down. Now there are some the other thing, I think most times, I think this comes first, sorry, apart from we talking about the local measures and so on, but if we want to go to the basics of you trying to clear someone's airways, because the throat, basically, the bone actually goes into the airways in your throat. And the first thing is to encourage people to cough. So that's, for the foreign body management generally, for children, for adults, the first thing to do is encourage them to cough. But I think because we are quite specific about bones here, the other things, if encouraging to cough doesn't work, is to go straight to drinking plenty of water and having a mold of Weber. If one doesn't work, try another one. If it seems like it's gradually moving with the EBA, you may need to try some more and see if it does help. And in between, from time to time, keep trying to encourage the individual or the child to cough. I hope I'm not taking too long on that one.
All right, thank you. So basically, I think a lot of people are happy to hear that.
Yeah.
I thank God that you mentioned the by yourself. So I know because basically that's what a lot of people do. They want to be sure that, okay, if they take a bath, does it solve it? Do they want to push it down, or do they want to cough it out?
Yeah.
Or what should be the measure? So thank you for clarifying the fact that, okay, so that means from what you said, it's okay if the bone is being pushed down, because probably eventually it's going to digest when it gets to the stomach, and of course there won't be a problem passing it out. So I think our viewers are happy to hear that, of course. So you cough it out. If it's not coming forth, you take water. If not, a bath or any other thing. I know some people have talked about maybe making use of bread soaked in water, taking a bolus like the way you take a bath. So you make a big chunk, then you swallow it. Some have thought of, I don't know, olive oil. There's a place for olive oil too. I think some have said maybe it makes the whole throat or the esophagus, make it slippery, then there's a lot of things. So, but basically, I think you've mentioned the major part, that once you're able to push it down, probably with a chunk of EBA or water, then of course that is it. And once it goes down, then there's nothing to worry about. And of course, I know that most times, is it not possible that just because of the way, of course, the bone has sharp edges, is it not possible that along the way, probably a lot of people don't even have it there. They just because they are feeling that pain that's what have been caused by the injury, probably while the bone was going down. Maybe that could just be the effect that they are feeling at that particular point in time. So what I will ask is that even when all these measures are taken and you still feel that there is something in the throat, even though you are not seeing it, and of course there's no respiratory abnormality, I think can the person go to sleep, or the person still needs to do a double check?
I mean, I think it's more of initially when one has got bone stuck in the throat, you know that you've got a greater discomfort there. So if you try measures and it seems that all of a sudden it seems a little bit relieved, then you can assume that it seems it's been pushed down a little bit more. Yes, there will be some soreness because, all that area will be sore because, and you may have some scratches as well. So it might be something that there is something called deflam spray sometimes, which is like a numbing agent, which you can get and spray in the throat, which can help just calm the pain and the soreness in the area. So it's all about how the individual gauges pain. So if you think, oh, this pain, I don't feel any difference at all, then it means that probably the bone is still there. But if you notice there is a difference and it's slightly better, then you could, give it a couple of hours, see if things are getting better. If you're still having problems with swallowing, pain on swallowing, then you may need to seek advice.
Okay. All right. Thank you. Thank you for the enlightenment. Okay. So basically, most actually be taken care of at home. I know people get worried, of course, you understand, because nobody wants to go through surgery. Nobody wants clothes to be slit up. So that's why a lot of people are worried about that. Okay, so this is the festive period, and a lot of people are going to be traveling. A lot of people are going to be spoiling themselves. They'll be eating so well. They will attend a lot of bears, and a lot of things comes up during this period in time, and that is a lot of people start passing watery stools. A lot of people start having diarrhea and maybe food poisoning. So, of course, it's could span between the young and the old and the elderly. So, in a case where we find ourselves in the situation where we're having passage of loose and watery stool, what do you advise we do in that case?
Okay. Also, the key message is prevention better than cure. General hygiene measures when you're going to places, parties, hand washing, very important. And despite all, if it does happen, so symptoms mainly diarrhea, vomiting. And what happens in food poisoning or diarrhea diseases that one loses fluids, water, either by vomiting or from the back passage. The other thing is that we have some important substances in our body, like potassium, sodium. Some of these things are easily lost when you're vomiting or having diarrhea. So those two things are very key. And you want to make sure that while you're vomiting, while you're having diarrhea, you're taking plenty of fluids to replace this. So most times at home, whenever you vomit, whenever you have diarrhea, it's good to take little sips of water to make sure that you're trying to replace the volume of fluid that you've lost. It's important. I don't know if they still do them, but those days we had home remedies for replacement of salts that have been lost, and sugar as well, what they call salt and sugar solution.
Yeah, we still do ORS.
ORS, yes. I can't remember what the exact mixture is, but those days they used to count the tablespoon salt, how much tablespoon of sugar, and then mix it in, is it a liter of water?
Yeah, but now, of course, it now comes in a sachet, so there's a...
Okay. But sometimes, in the holidays period, people may be in places where they may not have pharmacies opened to get an ORS, but that's something that can be prepared at home. And mainly what the ORS contain, the sachet, which you mentioned, which you can get. So if you have a pharmacy open on that day, please feel free, go ahead, go get it. It does help you replace things like sodium, potassium, glucose, the sugars that are being lost. Diarrhea diseases, even most food poisoning cases are self-limiting, so they usually get better on their own, even if it's a virus that's causing it, and most times even if it's bacteria causing it, they do get better on their own. Mainly is supportive management. How do you care for yourself and support yourself, waiting for the body to fight off the illness? And supporting yourself means you're taking adequate fluids, you're replacing these nutrients and substances that are being lost, and you're keeping yourself well. And things to look out for, I'll just add that if despite all these things you start feeling very cold, lightheaded and dizzy, feeling very faint, your heart is racing, then it probably means that things may be getting out of hand and all your supportive measures isn't working, and you may need to seek medical help.
Thank you, Dr. Demo. So I like your approach. So basically, dear viewers, of course, if you would notice, he has been talking much about prevention, of course, which is key. In medicine now, the medicine is going towards prevention than cure. So things that we can prevent, we try as well as possible to prevent it. And of course, in this case of diarrhea, proper hand washing, and of course, not exposing your food to organisms is very, very key. And of course, regular washing of hands at every point in time. And he said something about the diarrhea that is self-limiting. So in Nigeria, all our parents basically, they like drugs, of course. Any small thing, of course, before you know it, they've taken drugs. But you've only mentioned basically sipping of water, replacing of fluid and the like. So are you please tell us categorically if there's a place for antibiotics in food poisoning, in diarrhea diseases, or the mainstay is still the fluid replacements? Or what's the impact of people taking Flagyl, Cipro? Is it needed, or is it just an abuse of drugs?
So, I mean, mainstay of treatment is supportive management. And most times you don't need antibiotics for diarrhea diseases or even food poisoning. I mean, but you also need to understand, as you said, the peculiarities of where you work. Sometimes we used to joke about it to say the bugs, the bacteria or the viruses causing this diarrhea diseases in Nigeria, are they different from the ones causing the diseases here in the UK? But, honestly, it not particularly different. Yes, we've got some viruses which are here and you will not have them there in Nigeria. But most times when you send patients over here for, send them for a stool sample, the similar bugs we know about that causes diarrhea in Nigeria are still the same bugs which are, are similar to the bugs which are isolated here. There may be a few cases. So we would say we wouldn't recommend antibiotics first line for treating diarrhea diseases. We would, in looking at Nigeria now, is most times people are in places where they may not be able to access healthcare. And sometimes, if someone is having diarrhea 4 days, 5 days, 6 days, doesn't seem to get better, it will be really difficult. And that person has got Flagyl is most times what is very common in Nigeria. It will be very difficult to convince that person not to have that antibiotics if he sees that as the only help. But medically speaking, antibiotics is not first line, so I'll put it that way. Supportive management first, and if that doesn't work, then you may need to seek for the help. Here, but when I say here, you need to understand that there are different. We practice in different places. You would most likely start antibiotics after so many days of diarrhea, after 1 to 2 weeks, most times, if the diarrhea is not settling. And that antibiotics will most likely come after the individual or the patient has been able to send in a stool sample, and you've sent that stool sample to the lab. And then the lab actually identifies the bug in it and says, I think this type of bug, you definitely need antibiotics for. So you can see the difference in way we are practicing, where here there's, healthcare is easily accessible. Someone can, on the day 2 or day 3 of the stool of diarrhea, send in a stool sample quickly and gets reported, as soon as possible, usually 48 to 72 hours. But that may not be the case in Nigeria, because people may not have access to healthcare, and they may not have that prompt to start antibiotics if they need to. So at every point in time is usually 24 to 48 hours, most of them should start getting better. If they're not getting better after 24 to 48 hours and it's getting worse, then it may be something that is worth seeking advice and maybe possibly rule of antibiotics.
Okay, thank you, Dr. Ndiomu. Of course, we know that in this part of the world, a lot of parents, they don't even want to wait for 24 to 48 hours. They just want everything to stop now and right now. So that's why a lot of people, when even they tell them that they're having malaria, the next time they will say they are having malaria and typhoid, and they will also want to use antibiotics when they've not been diagnosed to have typhoid. So of course, the system is quite different. Okay, so I will want to ask one particular question, and that has to do with a very, very sensitive part of our body, which is the eye. Of course, and this, of course, is majorly for our children. Of course, a lot of them, of course, you can't You might not be able to control the way they play at say some particular age, and a lot of things happen. Okay, even for in adults, yes. So, for example, due to any form of anything that might have happened, if there's a foreign body that goes into the eye, of course, I know there are different types of foreign bodies. Some are penetrative, meaning of course damage to the eye, but maybe in this case not really penetrative, not damage, but just a foreign body, and you just can't figure out what it is. In that kind of case, what can I do at home if there's a foreign body in my eye?
Washing the eyes or bathing the eyes in very clean water. So very important there to say clean water. So and clean water, I think people ask, what do you mean by clean water? So what we used to talk about clean water is potable water, water which, it's clean and devoid of any bugs or bacteria in it. Because some people may have foreign body in the eye and they go use all sorts of water to to clean the eye or bathe the eyes, and that would cause contamination to the eye and then probably severe infections and cause more problems. So if sometimes you find out that most times it's not the foreign body which is finally causing the problem, is how they've managed the foreign body in the eye. So mainly it's cleaning or washing the eyes with very clean water. On the tap most times will be good. With a good jet lag of water, just wash your eyes very well, and washing several times, and then assess, are you having any pain? Do you still feel like there is a foreign body sensation there? Is it gritty? Is your vision affected? Is it blurry? Are you seeing things in your vision? Those are questions to ask yourself to see if washing your eyes with clean water, if it has worked. If it has not worked, then sometimes you can try and see if you can open your eyes in the mirror as wide as possible. And is it something which maybe identify where is it exactly on the right eye or left eye, so you can concentrate your washing, bathing of the eyes. I wouldn't necessarily say for people to poke their eyes or, if it's something you can easily just scrape it off with a gentle clean, then it's something to do, but don't be too aggressive. Don't go deep. The eyes is a very, very delicate organ, and you want to be careful about it. And please don't use anything that contains any chemical, that will to go close to the eyes, because some of those things can become irritants to the eyes and cause even conjunctivitis. So clean water to wash the eyes, it's number one recommended when you feel something has gone into your eyes.
All right, thank you. That's quite insightful. Okay, so I just want to clarify. So, of course, the natural response when most people have foreign body in the eye is to rub the eyes vigorously. That's the immediate response. So I don't know whether it's just me or that's general. So basically, is it actually wrong to rub the eyes?
It's actually something that should be discouraged. Most of us, that's what we get tempted, is, as you said, is a natural response. But number one, why I say it should be discouraged is, even with coronavirus at the moment, we're advising people, careful with the way you use your hands to touch your face. So at every point in time, yes, regular hand washing to make sure that even if you do, your hands are clean. But it's very difficult for your hands to be clean all through the day, because as we go on, we touch the walls, we touch the railings, we do handshakes with people. You can imagine, on a regular day, if you're on the streets, in 1 hour, you might have seen a couple of people and you've touched their hands, and you don't know what they're carrying as well. So if all of a sudden you've got this foreign body sensation, it wouldn't be a good idea to all of a sudden use those hands to start rubbing the eyes. So a good number of times, it may not be the foreign body causing problems in the long run. It may be, the foreign body has created that opportunity for you to introduce bugs into the eyes. So the first thing is, I'd say wash hands, but more of, washing the eyes with clean water. And rubbing the eyes as well can cause some mechanical trauma as well. Rubbing the eyes, these eyelids become very sore. Even the globe as well can become very sore as well.
Thank you, Dr. Toby, for standing in. I appreciate. Apparently, we're talking about emergency, and I had to go and handle some emergencies. I don't know whether it was the topic that created the emergency. So thank you for standing in. So it's also good to have the preparedness. Having Dr. Toby on this call was just the preparation I needed for the emergency I wasn't expecting. So thank you, Dr. Toby. Thank you, Dr. Odiomo. Thank you for calling on board. So one of the things that created this emergency is the fact that a child was given an injection and the place becomes swollen for the last 3 months, and they've been trying to do physiotherapy and all that to resolve this. I know there's so many mothers on this platform, and I know that there's some individuals that might have gone through this. What is the best way to treat this? Someone gets an intramuscular injection, and an error happened, a mistake happened, and the place becomes swollen. And it's not getting better. This is more than a month or 2 months, and the parents are really they're really hungry about the turn of events.
Is that coming to me or is that coming to Toby?
It's coming to you.
Okay. So,
it's coming to you because I know that apparently the person was given a quinine injection. I know that when I was younger, we are always afraid of Novocaine injection because of the pain and there's a kind of sensation I can't remember, but the reason why I'm afraid of going to the hospital is because of that injection.
Yeah.
So apparently this child was given, a 2-year-old was given a quinine injection, and the place becomes swollen. I don't know whether the handling after. Or just tell us what we can do when it happens, so that parents, mothers, individuals that go through this can know what to do and how to prevent further complication.
Yeah, okay. So I think first of all is generally is if we're taking our children or even us as well. But in Nigeria, I know sometimes you can be put in very desperate situations where you may not be able to tell what's the level of competence someone is, and we just subject ourselves to them to give us these injections anywhere else, anywhere in our body. So injections are mostly intramuscular, so it goes into the muscle. Sometimes, it's not only the buttocks where you can give injections or where you've got muscle. Sometimes places by the side of our shoulder here, by the side of our thigh. Those are places where we've got good muscles that you can, put the needle in and then release the medication. And the body absorbs the medication through the muscles. The problem with the buttock area is the right place to give it is if you divide the half of the buttocks into 4. So the upper quadrant, the right or the outermost upper quadrant, that's the safest place to give it if you want to give it in the buttock. And that's because we've got some nerves that run through almost around the middle part or some other areas which are considered unsafe to give the needle to introduce the injection. Generally, prevention very important, as it's supposed to be a procedure where they have cleaned the area first of all. The person who's giving the injection has washed their hands very well, is wearing gloves and making sure that they're using very clean needles, make sure that the needles, no one has used it before, check that whoever is giving injections, bringing out these needles from the right, from an unopened pack, before, putting the medication into it or withdrawing the medication into it and then administering to the child. So now we've talked about, clean technique in preparing the medication and, getting it into the right syringe and needle. And then also the location where it's given, very, very important, not to damage, the nerves, most likely. Because the other thing that could happen sometimes is that sometimes nerve injury, and some children may be limping for quite a long time, or it depends on how bad the damage the nerve is. And that can cause some paralysis as well on that side. And then the reason why, a clean procedure to give the injection is important is abscess formation. Because when people are given if the needle is infected or carrying a bug, and you introduce into the muscle, you're not only giving the medication, you're also introducing a bug or a bacteria into the area. And that can cause swelling, it can cause pain, and then it can cause, an abscess, which is mainly a collection of pus. And most times, children may have swelling in that area, pain, fever, become very, very unwell. And sometimes it's not something antibiotics can take away, and they may need to go have a bit of a surgery where they need to put a nick and drain out the pus. So mainly, I think, complications of giving injection intramuscular will be query nerve injury, infection as well. And some people, they may have pain there, which may never go for a very long time because they've just hit the nerve, they've excited it, and they may have, a nerve problem for quite a while. So mostly, I think, for this particular case, I suspect, is it an abscess which has caused the swelling there? And maybe if the swelling gets organized, it probably may just stay the same, like a scar tissue. It's unlikely for an abscess to stay for months and months and not cause any troubles, because if an abscess stays there without it being drained, then it will cause, a generalized infection, what we call sepsis. So if the swelling is still there after the injection, 1 or 2 months, it's not particularly clear, because when we talk of an abscess, it's more of something which is, should cause more troubles in the early period, not really staying for 1 month or 2 months, except it's an organized abscess which has just stayed there. And if you've got if you've got an area, and be aware that when you have an injection, even with the COVID vaccines or with the vaccines people are giving intramuscular, things that can happen, you can also have local reactions. So it may just be that locally your body have just reacted in that area, but what we expect is some redness, some pain, some mild swelling, which should go down on its own over a couple of days or a couple of weeks. But if it's an abscess, we would expect that the swelling will not get better. It will be more painful. The swelling will be growing bigger, especially in light complexion people. You'll have spreading redness, and it can cause an overwhelming infection as well. If you notice any of these symptoms, swelling, worsening pain, associated symptoms like fever, feeling unwell, then, a medical personnel needs to have a look at that area to rule out an abscess. Hello? Hello? Hello?
Okay, Dr. Njomo, we are with you.
Okay, fine, sorry. So I was just, so I just hope I've talked on quite a number of things there. So generally, in terms of injection, intramuscular, when you give injection, what are those complications that we should try and avoid? And what are those things you should look out for? And I said, always start with prevention better than cure. Are we having the right people giving the injections? Are they using the right procedures to give these injections? After they've given these injections, what should we look out for? Is it a local reaction? Has there been a nerve injury? Has there been an abscess formation or a collection? And if there are any worries at all, then you need to seek advice from medical personnel.
Okay. All right. Thank you so much. That's quite insightful. Okay. So I think it's an emergency that might be quite common, but of course not very common, but of course it still happens, and of course a lot of people have had severe complications that have arisen from that. So basically we thank you for that information. So as parents, we need to be sure when we go to the hospital to take injection, we should not just overlook whatever the nurse is doing. We should just try and be responsible for our child and make sure that, okay, the injection is being administered correctly. Of course, with that, we'll be able to prevent cases like this from happening, because of course, we might not be sure of the expertise, and sometimes we need to be sure. It may just be cleaning of the site that could have caused this. Maybe there was no proper cleaning of the site, and that's what resulted in this. Okay, so I think the network of, okay, I think she's back. Okay, all right. Thank you, Dr. Edo.
Yeah, I think you need to unmute her.
Okay, I've been unmuted. Okay, so thank you very much for that explanation. Very, very detailed, very detailed. And that explanation will also allow parents to also, take a look at where is that injection going into, because you've divided the Botox into to the particular specific place that is LD and wouldn't cause any incident. I also want to ask you a question. Sometimes people have go through excessive vomiting at home. Sometimes when a young lady is vomiting, the parents quickly ask if the person is pregnant. And it's not just pregnancy that causes vomiting. Okay, so what happens in a boy that is vomiting excessively? So what could be done if a child or someone just find out that it's vomiting excessively and is not, sometimes when you are constipated or you're having to think about when they have someone around them vomiting excessively, what first aid measures could be done?
Vomiting can be very problematic because, the vomiting itself will not allow you to take those things that would help support you. And yes, it's not only pregnancy that causes vomiting in the female gender. Vomiting can affect male and female and has multiple causes. Common cause for vomiting is a stomach bug. So a bacteria in the stomach or general tracts, digestive system, where we eat and food goes through. And initially people used to think, oh, it's a stomach bug when I've also got diarrhea as well. No, sometimes stomach bug can cause vomiting. Some people, the symptom may just only be vomiting alone and may not necessarily cause diarrhea. But even though how hard it is while you're vomiting, very important is to replace the fluids that are being lost. So little sips of water, even if you keep vomiting, just try as much as you can tolerate to replace the fluids. And also the other thing which is being lost are some important substances, important chemicals in the body, like sodium and potassium. And you can buy this, some of them come in sachets, what they call ORS. You can buy this from the pharmacy to replace those important substances that are lost. Sometimes you may find yourself in places where even pharmacies are not open, and there are areas where they may not have these sachets. I remember those days when we're growing up, we had this salt and sugar solution where they have this mixture of how many tablespoons of salt and how many tablespoons of sugar. You can put in about a liter of water, and then just to replace the amount being lost. I mean, I can't remember, it's our mothers those days who know the right mixture, but I can't remember now. But I think now it's the ORS sachet is widely available. So most times I think you can get it in a local pharmacy to help replace what's been lost. Now, so we're looking at vomiting more about being caused by stomach bug, but things like, I heard the host talked about constipation. So things to watch out for is that you should be able to pass wind. You should be able to at least open your bowels in the last couple of days or so. But if you feel that you're unable to pass wind, your tummy is swollen, and then you should be wondering, is there something obstructing the flow? Because it's like from our mouths to our back passage, you know, it's like a pipe, a long pipe which has been folded. So if nothing is going down from the back end, then it may be that something is obstructing something in the middle. So if you're unable to open your bowels, or you know, to go to toilet, then you may need to be thinking, is there something else causing the problem? And if that's the case, then you may need to seek medical advice. If you're probably someone who, but it's unlikely for people to be that constipated to the point where you're vomiting. If it's constipation, most times some people are able to pass a little bit of wind. They feel a bit, you know, bloated. And there are things like laxatives, which, you know, can help you go. And before we're talking about medications, I don't want us to focus so much about medication, because most times things are handled even without medication. So keeping well hydrated, taking plenty of fluids will soften whatever is going in or whatever is within the tummy to allow a good flow down the pipe. Vegetables, fruits, high fiber diet. So, you know, high fiber diet, we say it a lot and people say, what do you mean by fiber? Things like cereal, or the cereal food, they really contain high fiber diets, you know, cornflakes, and you see some of them on the boxes, they say this contains very good high fiber. And don't be too scared, all these are vegetables, ugu leaf, ewedu leaf, and you know, they all contain good amount of fiber. And there are things that, you know, should be part of your regular diet to make sure that your stool is soft, you're opening your bowels freely, and generally they have some very good hygienic value.
Thank you, Dr. Diom. Thank you very much. Normally we used to do 10 to 11. This is 11:17. I know that some people are already itching to go out and wouldn't want to take so much of their times. I didn't see other questions posted, and I guess that our audience have been educated today. For me, I've learned some new things now, and while you are eating that fish, there's not really going to be a lot of fish this Christmas. It's going to be a lot of chicken. But while eating and observing table manners and all that, we should just be careful so that we don't choke on any of the meals and choke on water. Okay, so people choke on water as well, and it could turn south in some individuals. So what do you advise when things are going into our mouth? We should not talk.
Yeah, it's like general good table manners will say, don't talk while eating. And mainly it's because when you go down from your mouth, going into your throat, we've got a similar passage going into our lungs, and then the other one going into our digestive system where the food is supposed to pass. So you don't want to confuse the system, because what happens is that when we are eating, the passage going into our lungs seems to be protected. But if you want to talk while eating, food might leave the correct passage and then go into the airway, so where air should be going to, and then where it should be helping us talk. So that way you may then cause an obstruction. You may then choke on it. But as we talked about the bone as well, the first thing with choking is to encourage people to cough. So that way it forces whatever the obstruction is, whatever the foreign body is, it creates momentum from the chest, gives good pressure, and forces whatever is obstructing our airway to come out.
Thank you very much. So, we always hate it when we're talking and when we're hitting and our parents says don't talk. And I still find myself doing that even though as an adult. And I think conversations around the table also is always very interesting, really. So but it could lead to emergency. I think we need to find a balance while talking and eating so that we do not confuse our organs and confuse the food. I guess that's what happens. We confuse the food and the guy just goes another direction and it causes a problem. So we'll watch out for that as a daily way of preserving ourselves. Thank you, Dr. Idiomu. Thank you, Dr. Toby, as well. Thank you for coming online. Thank you all the audience. Thank you for supporting wellness webinar series. Thank you for your support, because if you don't come online, we wouldn't even continue this. And thank you for the testimonies. Someone sent a lengthy testimony last week to the group, and I was really very, very impressed what this does to people. The person actually said we should continue, whatever happens we should continue, even if there is two people watching, that we should just continue, that we don't know how much knowledge is being passed and how much information people come to terms with. Information is power. So thank you very much for always being on this timeline. And we've said some things for parents preparing for Christmas. Have your ORS, very important. Get it and keep it. The emergency is not what you are expecting, but it's something that happens and needs urgent attention. So don't forget to have your ORS, because the ORS thing keeps coming up in all the discussion. And of course, when you choke on food and all that, the first thing is to try to cough. And we also say that the first thing that we talked about was when somebody felt there's shortness of breath, open the windows, unloose the dresses, and allow fresh air to come in. I'm sorry I wasn't a part of some of those things, but I know that we've really gained some information and equipped ourselves with managing emergency during this Yuletide period. We wish you well and want to say thank you to everyone. Please don't forget to subscribe to our YouTube channel. Don't forget to follow us on our social media pages. We love you for doing this. We want to wish everyone on this timeline. Dr. Diom, what would you like to tell our audience before we go? Dr. I'll also give you time to say something.
I mean, generally, I'd say thank you very much for putting this together. Nigeria, I think information is very, very important. So any little way we can add to the enlightenment of the public, especially in health, is very, very important. While I was talking, I remember my youth service in one of the states in Nigeria where I'd seen a child where the parents had put the feet of the child on the hot stove and the child came with burns. And what they told me was that they were treating her for malaria. And I was, taking off my feet when I saw that. I mean, you could see how uninformed these parents were, and they did what they knew. So information is really key, because if we do not have the information, we may end up hurting ourselves, we may end up hurting our loved ones. So this is a very, very good program. And a good number of the things that you've learned today, please put them into practice and also inform other people. You may just be saving a life.
Thank you very much. Dr. Toby?
Thank you very much, Ma. All right, so I want to say a big thank you to our audience. They've always been there for us. Of course, even as we go into the festive period, of course, what I would like to say, of course, let's have some of these things handy. Of course, we might find ourselves in a situation where we might need to act first, of course, just like if I'm to use myself, for example, just like yesterday night before this morning, I never knew that my wife and my 2 kids are going to come down with malaria. But just because I had at least a dose, adult malaria and children anti-malaria, that's why I was able to at least scale through the night without any itch, and I'm able to attend this seminar. So there's some basic things instead of just carrying our children and just shaking them. In fact, by the time we shake them, sometimes I even causing more harm than good. There's some basic things that we should learn to do. So the time you are using to jump up and down while your child is vomiting, by the time you are giving oral rays and some other things, of course, it's going to save a lot, because the time that you are using to do unnecessary things, of course, the severity might get worsened. And of course, for a baby, for someone that is choking, it's very, very important, of course, to get anything out of the airway as fast as possible, especially for children. They put a lot of things in their mouth. If possible, stick your hand into the mouth and be sure that there is nothing that the child has ingested. That's for children and top. So I think, by and large, we should take charge of the health of ourselves and that of those that we take care of. And of course, basic thing, we need to keep sharing the knowledge. That's the essence of this. We need to keep sharing the knowledge to people. All right, I wish you all a wonderful season.
Thank you, Dr. Toby. So parents, individuals, let's arm ourselves with basic support that we have at home. Have your paracetamol at home. We're not saying you should have antibiotics at home. The doctor also said it. Most times when people are purging or passing loose stools, the first thing we want to do is to give an antibiotic. The first thing we should do is to hydrate the individual. And when that hydration doesn't work in the next 3 days, because naturally it will subside. You know, Nigerians abuse antibiotics, and unfortunately, we're not even researching as a nation into antibiotics. If anything happens and antibiotics don't work, that means people will have sepsis and nobody's going to help them. So let us reduce. I'm also using this platform to reduce inclination towards using antibiotics by all means. And when you start an antibiotic, please complete it. We're still going to do irrational drug use on this platform where you start, complete it. But it shouldn't be the first thing to do when you have emergencies at home. Let's equip ourselves with what to do. We already know when there is a swelling. We could rub and we could use press. Some people just have a pack of pure water that they put in their freezer. It's just there. Nobody is going to drink that. And that is for emergency. So whatever happens, I have one in my freezer. So whatever happens, I'm going to bring that out first. For me, it is what I want to use to save someone if it happens. So let us be prepared, because emergencies are not what we've expected. But if we don't attend to them, it could become a bigger deal. So thank you very much. Please don't forget to like wellness, like us on our wellness social media pages, wellness_care. Follow us on our YouTube, subscribe to our YouTube channel, and enjoy access to care. We are wellness enrollee that you're on this platform. Enjoy access to care during this Yuletide period. Don't forget to call the call center if there are any issues. But most importantly, let's prepare to handle little emergencies on our own so that we can save lives. Thank you very much, and wishing you the best of God's favor, the best of God's protection. Everybody in Nigeria needs protection now and all over the world. And of course, COVID-19 will not come near our doorsteps. You know, I'll still pray. But while you don't want Omicron to come near your doorstep, wear your mask, maintain social distance, wash your hands all the time, and make sure that you keep yourself safe. One of the things that we owe ourselves is to take care of ourselves. If you don't take care of yourself, who will? So enjoy the rest of the year and see you next year by God's grace. Thank you very much. Thank you, Dr. Ndiom, for joining us. Thank you, Mr. Joshua. We love you. We love you. How do you do? We love you. We love you. So see you next year. Until then, bye.